living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Many patients and providers are turning to the ease and convenience of using telehealth. Improvements in technology have made using telehealth easier than ever, even for those who might not consider themselves computer savvy. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Colleen Roylance. Today, we'll look at the basics of using telehealth, how you can get started, and what you need to know. Stay tuned. Welcome back to Healthy Living for Life. Joining us today is Deb Anderson. Deb is a health information technology expert who has been with Mountain Pacific for over 9 years. Deb, thank you so much for being with us.
Absolutely.
Hey, let's start with the very easy, basic question. What is telehealth?
So telehealth actually is a broad term that encompasses many variety or methods of virtual healthcare delivery. Sometimes we hear telemedicine and sometimes we hear telehealth. Telehealth to me means it's expanded and it actually can help with things more wellness and health related, not just what we're talking about for sick care. Telehealth is a way to receive telehealth services remotely through various communication technologies. And the American Telemedicine Association defines telehealth as the use of medical information exchanged from one site to another via electronic communication to improve a patient's health. I think it is a really good way to stay healthy versus needing any of those urgent visits for immediate diagnosis and treatment. Telehealth can be used to include monitoring and reporting information for things like daily blood pressures, blood sugar levels. Remote patient monitoring is also a service that can electronically report this information directly to providers and care teams for their review. So additional things like temperature and blood oxygen levels and weight are additional items that could be monitored and reported from home. So obviously, due to the COVID-19 pandemic, telehealth has become really more valued and utilized more than ever before because people were seeking health services in a way that prevented them from possibly receiving diseases and making those in-person visits.
Okay, so what you're describing, there are a lot of different types of telehealth.
Yes, there are.
And we can kind of use telehealth and telemedicine interchangeably, a little bit?
We can. I prefer using telehealth because I think it is more expansive. But, when we think of the medicine, we think of really important critical services like things in our emergency rooms or ICUs because it's, truly connecting with providers to evaluate and receive diagnosis. So there are, connections for telemedicine that can be implemented in our remote rural facilities. And now I've just recently heard a report about telehealth being implemented in some of our EMS services across our rural communities as well. So if we think of medicine as the specific connection with the provider to seek a diagnosis or between provider to provider, so a lot of times it's going to be, one provider talking to another provider versus just a patient talking to the provider. And again, I like telehealth because I think it's more inclusive and more expansive and helps patients understand some of their choices that they're able to make and some of the services they're able to receive remotely.
And you mentioned a lot of different types of conditions that telehealth can help with. One thing that I didn't hear you mention is medications. Can you use telehealth for medications as well?
Yes, you can. Again, there are some requirements or restrictions for the providers. They may need to do a thorough physical evaluation before doing an initial prescription. But for the most part, telehealth is wonderful to use for check-ins and follow-ups and getting like a refill for medications. Again, it's something I would really ask a person to talk to their provider about, and maybe if it's something that's critically important, they make a phone call to find out if this particular provider would evaluate and do a medication prescription via telehealth.
So there may be some providers who don't even offer telehealth. Is that true, or has this become pretty widespread?
I would say there's still a few who don't. We have some of our old school folks in the rural communities that probably just aren't that comfortable with the technology. But it's interesting as we go places and we do more presentation. I think even some of our providers who were a little bit hesitant to use some of the telehealth services are now understanding the huge benefits that they can bring to the table to incorporate additional people into the care team for the patient, and also including other family members. I've heard some wonderful examples about caregivers who maybe aren't able to be at an appointment, that they're connecting remotely from a rehab center, or where someone is trying to receive additional services in recovering from one of their acute conditions. So the telehealth piece can actually connect not just 1 or 2 locations, but 3, 4, or 5 if we need to. So it's an excellent tool, I think, in the tool belt. And again, I think it's up to the providers and the patients to be bold and take the steps necessary to look at implementation of telemedicine and telehealth in their practices.
That's awesome. I mean, it really sounds like a great tool to use, and there are a lot of benefits. What are some of the disadvantages to telehealth?
So obviously there are going to be some situations where a telehealth appointment may not provide all of the information that would be needed for a specific type of evaluation. While we have emerging technology, a couple examples I could use is if you're wanting to see an orthopedic surgeon about a joint that you're having pain with, that person really probably wants to get their hands on your shoulder, your knee, or whatever it is that you would like evaluated. Another example would be when the neurologist is trying to assess the gait or how you walk. There are now gait mats that are out, but that's not something that a patient's really going to have in their home. So again, I think there are certain limitations in certain situations where it's not appropriate at this point in time, but we hope as technology continues to advance and emerge, we'll have some solutions for that as well.
Thank you, Deb. That's really great information. We need to take just a quick break, but when we come back, we're going to continue talking with Deb about telehealth and how you can get started and what you need to know. Stay tuned. We'll be right back. Welcome back to Healthy Living for Life. We're still talking with Deb Anderson about telehealth and how it can be extremely beneficial to those folks who need it. Deb, let's talk a little bit about the equipment. Is there special equipment that's needed to conduct telehealth with your provider?
So during the public health emergency, there were several waivers made. And one of the things is there was a big promotion of using just the regular telephone. So it can be as simple as being able to place a call or receive a call from your provider. However, for those of us who get to use wonderful tools, video conferencing tools, we know that there's also the benefit of seeing the person, making this connection via video. So in that instance, there are other technology, other platforms, other systems that may be required. For the provider, it does mean being able to set up and utilize a two-way video communication. And sometimes those are easily accessible to them already inside the electronic health records that they're using to work with patients. Sometimes that might mean going out and getting, a separate HIPAA compliant platform, for example, Zoom, like we use a lot of times in the work that we do at Mountain Pacific.
Okay, sorry, Deb, continue. Sorry.
No, that's okay. So the other thing is a regular telephone isn't going to really work for a video conference. Obviously, we need some sort of device that would have a camera and audio availability, the microphone on the device as well. So smartphones are great for that. A laptop or even, just a tablet could be used for telehealth. And again, I think that we'll continue to see improving technologies to make this even easier as we hopefully continue to keep moving forward with telehealth across all of our communities, not just our rural communities.
Okay, so if I want to use telehealth and the provider has a telehealth platform, do I have to download something on my phone or my tablet or my computer in order to do this?
So that depends, and I know that's my favorite IT answer, but let's say that there's an app, a smart app that can go on your smartphone. I have used those in the past. Teladoc is an example of an app that I can download. I can look to see, is there a provider available for me to talk to immediately about my sore throat or my drippy sinuses? There are other platforms that do not require any type of a download at all. So unfortunately, there's no one right, easy answer, but it's usually something that the providers and their teams are ready and willing to help everyone with to make sure it works appropriately for them.
Okay, and if I wanted to use telehealth, do I need to meet with my provider beforehand? Is that a requirement before I can start using telehealth?
So it is not during the waivers for the public health emergency. However, if this is a provider that's new to you, and this is someone that you're trying to establish a long-term relationship with, sometimes both the provider and the patient would agree that an in-person visit may be best. But in examples like the phone a doc, call the urgent care, a lot of times I won't know if I'm going to talk to a provider that I have a relationship with. And that's just kind of part of that more emergent service or that quicker service of getting to talk to a provider and say, hey, I think I have a sinus infection. What are the next steps we would like to take to help me diagnose and treat that appropriately? It is not a requirement. I'm hoping that it doesn't remain go back to becoming a requirement, because I think there are obviously ways that people can develop relationships even if it is just in a virtual environment.
Okay. And one other quick question. If you're not seeing your doctor, how safe is telemedicine? What if they miss something?
So I think we trust that our providers and their care teams are really smart people. So are the patients and the families. If during the conversation anyone is just decided that, there may be something more that is needed, obviously, if they want to order a blood test or an x-ray, do any types of shots or vaccinations, again, do a physical manipulation and check your shoulder or your knee, those are things that together, I think, as a team, they're going to decide that an in-person visit is going to be much more appropriate. Also, remember, it's important in emergency situations, things like chest pain or one-sided face drooping or a broken bone and some blood, you probably really want to get in to see someone in person.
Yeah, that makes good sense. You mentioned a little bit earlier about HIPAA and confidentiality. How is that ensured? My privacy and my information is kept confidential.
So HIPAA is, directives from CMS on how we protect patient privacy and security. And at any time, a patient would be encouraged to ask for those notices of privacy practices. And remember that electronically, your electronic information is as protected as any paper information would be as well. The things that I think I would encourage the patient or families to be aware of is it's just as important for you to keep the information safe as it is for the provider. So if you're going to do any type of a telehealth visit, you would want to be in a nice, private, quiet place where not only you have a private connection, but you also are probably going to be able to hear better and have a better interaction with that provider. And again, the providers are required to protect your electronic information just as thoroughly as they are any paper documentation as well.
That's really helpful information, Deb. Thank you so much. We need to pause for another break. When we come back, we'll continue talking with Deb about telehealth and really about the future of telehealth and what that looks like for getting our care. Stay tuned, we'll be right back. Welcome back. We are diving into telehealth, and we've got Deb Anderson, who is a health technology expert, joining us. Deb, in this pandemic, there were a lot of visits that were canceled or postponed because they didn't want to meet in person. But then there were a lot who did use telehealth. So can you talk to us a little bit about what you see as the future of telehealth?
Well, it's kind of a joke amongst all of the technology folks that we really don't want to see this toothpaste go back in the tube. I think we have proven that there is a tremendous benefit to telehealth and improving access, reducing cost, hopefully reducing hospital admissions and readmissions, that we don't want to see it go backwards. And I know there are several state and federal initiatives that are underway trying to make sure that we can protect many of these changes. So I think I have my fingers crossed that we will not only be able to continue providing telehealth the way that we've been able to during the public health emergency, but also find maybe even better ways of improving the quality and creating more patient satisfaction. I, for one, really like the ability to talk to my provider online, so I don't have to drive 30 minutes or 2 hours to go in for a quick checkup or a check-in on, how I'm doing these days. So my goal is that we all work together, we all use our voices, and we all continue to say this can be a good solution for all of our populations, not just in rural communities, but across the nation.
The COVID pandemic, and it's not just the COVID pandemic, but some of the other healthcare issues are really contributing to a workforce shortage. Is telehealth something that can help with that shortage?
I think we've seen a lot of data that shows that it can. During the pandemic, there were several organizations that stood up solutions with remote patient monitoring, and they were calling it hospital at home. But remote patient monitoring is really just a way to digitally transmit information, things like your blood pressure, a blood sugar level, your temperature, your weight, back to a team that can actually monitor and make sure that you're connected, and if there's things that they see, there's access to services and providers who can reach out to you versus you having to reach out to them. I really think that we can continue to make significant improvements in the utilization, the education, and obviously still, I think, in connectivity and the technology as well. But I do truly think that we have something good going on here, and I, for one, want to make sure that we're promoting the continued use of it.
So let's talk a little bit about equity. So you did mention the rural communities, and there are a lot of places where broadband is an issue. Does telehealth help or hurt equitable access to healthcare?
So it definitely uncovers additional challenges, because we do obviously know that if you can't afford a smartphone, if you can't afford broadband access, then telehealth probably isn't going to be a good solution for you. However, there are a lot of programs, both locally and federally, that are trying to address many of these barriers. One I would like to mention specifically would be the FCC, or the Federal Communications Commission, has created programs where they are funding no-cost or low-cost broadband connections for families, and also supporting places where we can expand out other areas for telehealth services. And these can include really creative solutions like the county extension offices, the public libraries, school-based clinics. So I think, again, there's a lot of acknowledgement of why we need to try to address the gaps in equity, because, again, in some cases, we probably increase that gap versus being able to lessen it. And again, while it may be a great way to address the equity or the gaps in care for rural communities, there are still folks out there who will have other issues or other concerns that we need to help eliminate as barriers.
So you mentioned national efforts. Are there any state or regional or local efforts to bring telehealth to a larger population?
Absolutely. I'm assuming that we probably have many initiatives in several states. I know in Wyoming, there is the Wyoming Telehealth Consortium. We've been meeting for years, even before the public health emergency. And there is another association in Montana called the Montana Telehealth Alliance. And the primary goal of these groups is to find ways to address the barriers and continue to collaborate and work together to address what we can address and obviously to educate all of our populations. We've got a great partner with AARP who's helped us get the word out quite a bit on some of the projects and things that we've been working on, and even coming up with collaborative things that we can do together that have been very successful.
We've got just a few seconds left. Deb, is there anything else that you'd like to add to all of this great information you've already provided?
I do. Really quickly, I would like to say that our friends at the Northwest Telehealth Regional Resource Center have launched a website called findtelehealth.org. That would actually help people and providers to find others in the areas that would provide telehealth services. I would also like to encourage everyone to be bold, to ask their questions, and remember to take care of you. I know that some of us allowed a care debt to kind of build up during the pandemic, but it's your voice and your choices to seek the care that you need that is going to help you be healthy and live a long and wonderful life. So please reach out and make that virtual connection. And if there's anything that Mountain Pacific could do to help you with those things, please don't hesitate to reach out to us.
Thanks so much, Deb. Thank you so much for being here today. And thank those of you who are watching. We hope you'll join us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.